Hello. Today my topic is identification of sleep disorder control mechanism by stimulation acupuncture. This is Suyan Seo. I'm from Korean Institute of Oriental Medicine. First of all, I would like to thank you to moderate Professor Bong Hyori for giving me an opportunity to making the presentation. Today, my topic is the sleep disorder. It is not drug addiction, but I think it is a very relatable topic of the acupuncture stimulation in drug addiction. I hope that the researchers who want to study about the caffeine addiction will get an idea from my presentation today. First, let me tell you about the mental disorder. Well-known mental disorder include stress, anxiety, schizophrenia, depression, and personality disorder, and sleep disorder. This group anxiety, depression, and theirs combined. The yellow bar is the before COVID-19, the red and purple bar is the post-COVID-19. Since the COVID-19, mental disorder have increased significantly. Dated up to the 2020, I couldn't find any statistics after the COVID-19 overall. But as of the 2023, mental disorder will have increased further. All mental disorders are interconnected. People with depression have insomnia. Some people and anxiety may also have insomnia. Conversely, people with insomnia may develop depression and anxiety. In this way, all mental disorders are related by insomnia. What about the disease? Representative neurodegenerative disease include Parkinson and Alzheimer. As our aging society progresses, neurodegenerative diseases are increased, and increased by 2050 is it much. Of course, the main cause of the neurodegenerative disease are diverse. There are genetic and environmental factors. It is different to control of the genetic effect. However, there are some environmental factors that can be improved through our effort. Among the environmental factors to neurodegenerative disease, sleep is the most controllable. Sleep disturbance have been early symptom of the neurodegenerative disease. Additionally, the neurodegenerative disease can be bad due to a sleep disorder. In the case of the Parkinson's disease, early symptoms include the motor abnormality and the olfactory dysfunction, and constipation, depression, and sleep disorder. In particular, sleep disorder are important factor in predicting the development of Parkinson's disease. And this is also important indicator for understanding Parkinson's progression. REM sleep disorder, one of the symptoms of the Parkinson's disease, leads to the progression of the disease. And the REM sleep stage is rapid eye movement and the dreaming stage. It is characterized the REM sleep, increased brain activity, and temporary muscle paralysis. During the REM sleep, the brain remains awake and produces the vivid dream. REM sleep also plays important role in the cognitive progress, emotional regulation, and memory consolidation. For this reason, it is important to regulation REM sleep to slow progression of the Parkinson's disease. This is a really hot topic these days, right? It is drug addiction. Drug addiction is an emergency as the social issue. Our country is no exception. Many of the presentation in this session today are about the treatment of drug addiction or the basic mechanism of the drug addiction in acupuncture. Of course, sleep disorder is not the main symptom of the drug addiction. However, one of the main causes of the drug addiction may be sleep disorder, I think. As you know, imidazopyrin or benzodiazepine, which are representative sleeping pill, as also sedative drug in drug addiction. In addition, one of the side effects of methamphetamine, cocaine, and heroin is sleep disorder. In this way, various diseases related to emotions are related to sleep disorder. Some case, it can act as the cause of the disease. Some case, it acts as the result of the disease. Therefore, sleep regulation is important to protect our health from the various diseases. It can be an essential element. So, should insomnia be treated with acupuncture? Let's compare the treatment using the drug and acupuncture. This is the problem of the sleeping pill. First, taking the expression amount of stimulation, sleeping pill can cause excessive sedation. And two, sleeping pill can reduce the cognitive function, cause the problems such as ataxia and muscle relaxation. Stimulation the central nervous system and reduce the brain function. And next, long-term use of sleeping pill increase the risk of the dementia, although the direct link requires further study. That is why patients feel burdened by pharmacological treatment and they're looking for the non-pharmaceutical method. Meanwhile, acupuncture treatment has advantage over the meditation treatment. You will know that the treatment without the side effect. This is perhaps the greatest advantage of acupuncture treatment. In the previous slide, I mentioned that the sleep disorder are linked to various mental disease. Sleeping pills are simply medicine that help your sleep. But acupuncture treatment, it acts as the multiple target to improve the sleep quality along with the depression and anxiety by reducing heart heat and stabilizing your nerve. Acupuncture has no side effect and acts as a multiple target. For this reason, acupuncture can be used to stabilize throughout your life without worrying about the tolerance. What about the advantage of acupuncture compared to non-acupuncture pharmacology treatment? First, it is the characterized pharmacological treatment used for controlling insomnia. The representative method of controlling insomnia is exercise. Although it is a critical and effective treatment, but I think it is not best. In addition, CBT treatment is a representative treatment. However, the CBT treatment requires consistent treatment and there are individual differences in effectiveness. Continuous treatment can be difficult because it can be a long time and cost a lot of money. In comparison, acupuncture is an economic treatment. It is a more active treatment method than exercise or many CBT methods. As such, acupuncture treatment has many advantages over the pharmacology and non-pharmacological method to treat insomnia. Therefore, acupuncture treatment is already being actively used in clinical study to treat the insomnia. So, what about the mechanism of the acupuncture to control the insomnia? I will show that the evidence discovered from the basic research. In 2023, a review paper summarizing the mechanism of the insomnia control in acupuncture treatment has been published. I will explain it based on this paper. There are details have been investigated since the 2015 on the mechanism of acupuncture treatment in the animal experience related to insomnia. Okay. Diseases are largely divided into insomnia and sleep disturbance. Also, insomnia is a clinical condition. Sleep disorder cannot come on the mainly individual and do not always require the medical treatment. Animal model mainly done is the rat and mouse. Using the electroacupuncture and manual acupuncture and Mongolian medicine worm acupuncture. We find the various needle points, especially HT7 and GV20 is widely used. This table is about the research on the mechanism of acupuncture treatment can control sleep disorder. The reason sleep research is difficult is that the brain region individual are not yet clearly identification. As you can see, there are so many parts of the brain that control sleep. Hippocampus, the mainly study. In addition, this you can see the amygdala and cortex and cerebellum. Various sleep-related factors were monitoring to identify mechanism. It can be seen the GABA, BDNF, and the opioid system were mainly studied. So far, there are brain parties affect sleep control. From the activity control perspective, you can see the blue is the upregulation and red is downregulation. I studied the mechanism mainly is the medial septum. So today, I'm gonna talk about the up and down control system of the medial septum area. I focus on the role of the BDNF in identifying effective mechanism of the sleep control shown by acupuncture treatment. BDNF is brain-derived neurotrophic factor. You can see there are many various effects. The BDNF has so many different rules. So it is applicable to many neuroscience researchers' study. The meaning of BDNF is a little more special to research from the mechanism of the acupuncture. We can find the reason, the property of the BDNF receptor. After BDNF secretion from the nerve cell, it is cleavated. After the cleavated BDNF is divided into pro-BDNF and mature BDNF. Cleavated BDNF binds to each receptor. The BDNF for pro-BDNF and P75 NTR and sortilin. The receptor for the mature BDNF are P75 NTR and TRKB. As each BDNF receptor is different, their functions are also different. Pro-BDNF binds to each receptor and induce the apoptosis. But mature BDNF binds to a receptor and inducing cell survival effect. Based on this difference in BDNF effect, depending on the receptor, the theory regarding the bidirectional treatment mechanism of the acupuncture can be explained. Emotion disorder include various of disease. The four disease model present here emotional disorder model that I have been researching for past 10 years. I collected the result from my past study. Do you see some similar? Yeah, this is HT7 was used the acupuncture treatment point, and there are the active area of the brain was significantly different, but acupuncture treatment has affected on the increased BDNF. As a result, all the thema of my research has changed. The main thema is always acupuncture and increased BDNF. The most important thing to consider when the created insomnia model is to create the excluded stress. This is because the insomnia model induce the stress is ultimately in the stress. And one of the phenotype of the stress is insomnia. For this reason, we want to find the optimal insomnia model that excluded stress. In my sleep disorder study, I used caffeine. I used IV injection of the caffeine and the caffeine water drink. The drinking model has been advantage of being the model that is close to clinical patients because the rat drink themselves. However, there is a disadvantage the caffeine intake level from rat to rat. In the case of the injection model, we can induce the sleepiness whenever we want. However, stress cannot be ruled out. The following is the sleep measurement equipment and acupuncture treatment method used to study sleep disorder. To study sleep disorder, 24-hour sleep pattern must be investigated. For this purpose, EEG was measured. We can measure the brain wave for 24 hours. 24 hours and check the REM sleep and the wake time and non-REM sleep based on the measured brain wave. In particular, the EEG equipment I used the wireless brain wave equipment, which has the advantage of allowing continuous monitoring while minimizing stress. The acupuncture stimulation point is HT7. For HT7 stimulation, electroacupuncture stimulation or vibrating needling were used. Especially, vibrating acupuncture is acupuncture treatment method developed by the Daegu Hany University. Thank you once again for dividing the equipment. And this content was published as a paper last year. This is a research paper that confirmed the change the BDNF that occurred in the medial septum area in the caffeine intake model. In order to use the caffeine acupuncture to treat sleep disorder, it is important to determine the time of the acupuncture treatment. So we first analyze the wake time and non-REM sleep time in the normal rat for 24 hours. In our breathing environment, the right turn on time is 8 o'clock and the turn off time is 8 o'clock. In this environment, the rat activity began to decrease the 3 hours after light was turned on. At that time, REM sleep began to increase because rats are nocturnal. The become activity when the light off. For this reason, we perform the acupuncture treatment for about 20 minutes, starting 30 minutes before going to sleep. After the light turned on and acupuncture treatment was performed, sleep was measured earliest from the 12 o'clock to 6 o'clock in the evening. This is because the time peak during the caffeine is known to be about 6 hours. Our EEG results show that the wake time increased and the REM sleep decreased in the rat administered caffeine. However, the acupuncture group recovered the same level as the control group. Right is the open field test result. In fact, open field test result tell us all many information. Typical symptoms include depression, anxiety, and mobility. Caffeine administration created the aura cell stage. We confirmed this with the total travel distance of the open field text experiment. As a result, it was increased the caffeine intake, consistent with our EEG result, and the total distance measure was restored by acupuncture treatment. When sleep is disturbed, the stress response occurred at the cellular level. Among them, we focus on the endoreticulum stress response. Insomnia worsened, misfolding protein increased in the rat brain. It became a ER stress response. The representative marker of ER stress is BIP. BIP. For this reason, we measure the BIP expression in the sleep-related brain region. Considering the regulating effect of acupuncture on the autonomic nervous system, the cholinergic system was set as the target area. Two parts of the brain region, forebrain region, medial septum, and ventrodiagonal band of Broca region. And brainstem region is laterodorsal tegment and peduncular tegment. As a result, to checking the BDNF expression level in this region, the significantly difference in the medial septum area. In fact, there are many research showing the medial septum area control the REM sleep stage. The red part you can see here in the medial septum. In the medial septum, glutamaltergic, cholinergic, and GABAergic neuron work to regulation to sleep. Our study experimented whether acupuncture treatment change BDNF expression in the medial septum area. First, the expression level of pro and mature BDNF using the ELISA assay. And the statistical significance of the mature BDNF was confirmed. Based on this, the phosphorylation level of TRKB, the receptor for medial septum, for confirmed and significantly increased in expression was found due to acupuncture treatment. In the next experiment, we confirmed whether BDNF increased by acupuncture treatment, regulation of expression of ER stress. We checked whether ER stress alleviated by acupuncture treatment after pharmacological blocking TRKB. The blocker name is ANA12. As a result, it was confirmed the acupuncture treatment cannot relieve the endoreticulum stress when the BDNF receptor is blocked. Conclusion: when acupuncture is applied to an animal model of insomnia induced by caffeine administration, this is increased ER stress at the medial septum site. This increased ER stress can be controlled by increased BDNF, thus the acupuncture treatment. This is part 1 of my sleep disorder research. And next, experiments is the caffeine intake model. This is the experiment to check the effectiveness of the acupuncture treatment focusing on the inflammatory response in the medial septum area. First, the REM and non-REM and wake time were confirmed based on the wireless EEG equipment. As a result, REM and non-REM sleep decreased, the wake time increased due to the caffeine administration. It can confirm that the acupuncture treatment can alleviate the effect. The experiment on the right is open-field test result. As a result, measuring total travel distance and the resting time and the immobility time, it was found to be consistent with EEG result. Previous study, we confirmed the importance of the medial septum area in sleep regulation. This time, we investigated change in inflammatory cytokine in the medial septum area. As a result, analyzing 36 cytokine, in the expression level of the anti-inflammatory marker was significantly different than the pro-BDNF marker. Among these results, the pro-BDNF marker IL-2 and the anti-inflammatory marker IL-4 and IL-10 was classified and confirmed, and the statistical significantly different was found. The experiment on the right is the result of the tissue staining in the medial septum. It is known that the microglia type 2 induced the anti-inflammatory response. The expression of the arginase 1. Arginase 1 is the microglia type 2 marker. It was found that microglia type 2, which regulation anti-inflammatory in the medial septum, was increased by acupuncture treatment. Next, the third ELISA assay, we confirmed whether the inflammatory marker changed with the acupuncture treatment. Looking at the result, the statistical significantly increased in cytokine was confirmed in IL-4. Based on this, we confirmed the phosphorylation as a sub-mechanism related to IL-4. As a result, it was confirmed the phosphorylation of STAT6 and FIS38. The inflammatory response induced the caffeine increased IL-4 and P38 and the P-STAT6 phosphorylation, which was increased through the HD7 stimulation. Starting with this, we can predict that we will be able to control various responses within the brain. Yeah, it is conclusion of my two project. First, caffeine intake is the ER stress response in the medial septum area. And HD7 stimulation reduced the ER stress response in the increased BDNF. And the expression of anti-inflammatory marker in the medial septum area is decreased. Acupuncture can increase the activity of arginase in the medial septum area and the regulation of the phosphorylation of downstream of element of IL-4. It is a limitation and further research. It is necessary to understanding mechanism of the acupuncture, why acupuncture treatment increase the BDNF. As a hypothesis, I'm focusing on the vagus nerve stimulation effect on the acupuncture treatment. Additionally, it is necessary to determine which key signaling is the ultimately controlling by the reducing ER stress and the regulating anti-inflammatory marker in the medial septum area. I believe that only discover this key signaling can the mechanism of the effect acupuncture treatment be completed. Thank you for attention my presentation.